It's a movement meant to make healthcare more transparent and empower patients by giving them access to notes from their doctor visits. Our news reporter Mary McCombs joins us now from our newsroom with more on a collaboration between two local hospitals that will make Rochester the first region in the state with community-wide access to the open notes system. Mary?
Well, Casey, here's something that's probably happened to many of us at some point. You walk out of your doctor's office and all of a sudden you forget some of that conversation that you had with them regarding your health. Well, now patients can get easy online access to the doctor visit notes through this collaboration between Rochester Regional Health and UR Medicine. Navigating the healthcare system can be challenging for many patients. That's why healthcare leaders in our community want to make it easier for people to see their doctor's notes.
And at the bottom, there's the link to access their visit notes.
Here's how it works. After an appointment, a patient will get an email letting them know a note is ready to view online by clicking on an additional feature on their patient portal.
We believe in engaging patients in their care because in order for them to be the healthiest that they can be, they need to understand how their care is being enacted, why it's being enacted, and be an active participant.
If you want a family member or a caregiver to have access to your records, it's as easy as sharing your password.
It should be a move that will really enhance the level of communication and engagement around health. And we know that engagement around healthcare is the differentiating feature between those who stay healthy for a long, healthy life versus those that do not.
And for some doctors who say that a computer right now keeps them from spending more time with the patient, UR Medicine says a work impact survey showed little impact on increasing workloads for the physician.
It's sort of a leap of faith. You just have to try it. But all of these, I think it's now up to 150 institutions across the country that have done this before us, all come back and say the same thing. It feels scary, it feels like it might increase the workload, but in reality it has very little impact.
Now, UR Medicine began a voluntary note-sharing pilot about a year ago at most primary care and specialty practices. Rochester Regional Health has piloted note-sharing since last September. Now, healthcare leaders say that although this is a tool that is available, it is not mandatory, and really, a discussion really has to happen between the patient and the provider to reach a comfort level. Casey, we'll send it back to you.
Seems like a good idea. Seems like a lot of common sense. Mary McCombs in our newsroom tonight. Mary, thank you.